muscles for the two portions, the sensory portion and the motor portion of the pupil. Sensory portion is reacting to the light. Motor portion is what it does after it reacts to the light. You can't really separate them. Shine a light in someone's eye and it reacts. You have to assume sensory portion is intact and motor portion is intact. If you have a problem with the motor portion of it, you're going to have to rule it out some other way. Because you can't tell, is it motor or is it the sensory issue? I don't know. Okay. So we're going to call it oculomotor nerve, cranial nerve 3 for pupil, but really the sensory part of it is cranial nerve 2. But we really can't separate that testing. Does everybody understand what I just said? So we're not going to do cranial nerve 1 because, you know, that's not going to be really important to us as therapists. I'm going to need to put my glasses on. Optic nerve is reading, so I could ask her, can you read C, D, and E for me?
C, D, and E, ocular motor, trochlear abducens, equality of pupils, reactivity to light, eye following a target, observe for ptosis.
Okay.
Trigeminal, sensory test of face, open and facial, raise eyebrows.
Any difference between them?
Oh yeah, I have better vision in my left.
Okay. Do you wear glasses or?
Yeah. Because I don't need to, because I can see them.
She can see, it's just not perfect. Okay. So that's how we can test visual acuity. So for the optic nerve. Cranial nerve 3, 4, and 6. On cranial nerve 3, what are the muscles?
Ocular motor. Oh, sorry.
It's oculomotor, it's a nerve.
Superior something, inferior oblique. Superior rectus, inferior rectus. Inferior oblique.
Medial rectus. Medial rectus.
There you go.
Okay? Cranial nerve 3. So what we would expect the eye to be able to move up, move down, move in. Okay, for that cranial nerve. Now again, we check them all together, but those are the muscles. And I know that Dr. Kitteman asked on her practical what muscles were the cranial nerve. I know for a fact. Even though it wasn't in the rubric.
I didn't know that.
She's tough. Oh, was it you?
This is fun. What?
Oh,
Yeah, it was last time.
okay.
Whatever.
Cohort.
Yeah. So to test 3, 4, and 6, I'm just going to show you the test for all of them. We'll separate them out one at a time. Basically, so I'm going to ask her, I want you to keep your head still, and I want you to follow with your eyes this. So bring it all the way out, all the way to the other side. I'm looking for symmetry, all the way up and out, down and out, up and out, down and out. So you get the obliques in there. Okay. So for cranial nerve 3, it's up, it's down, and it's in. Okay? Cranial nerve 3. We're looking for symmetry. We're also just observing symmetry of how her eyes sit. Because remember, or how her head and neck sits, because when you have cranial nerve 4, what do? They tilt their head, right? To try and even out their eyes. Okay? So you're looking, so she may be sitting like this, and her eyes look fine. But do like this, and now her eye looks like it's up and out. So make sure that they're sitting in a good posture. Again, I don't want you to be able to say, oh, it's definitely cranial nerve 3, not 4, not 6, definitely 3. I'm going to go to the therapist. I just want you to recognize, I'm giving you that additional information for the exam, but you know, that's not what you need to know clinically. You just need to recognize when it's not right and to know how to test it correctly. Everybody got me? All right, now, for pupil, we want to look to make sure that we have constriction of the pupil when exposed to light. So it recognizes the light and it closes the pupil down. And we also want to look for what they call consensual constriction. So when I shine a light in my right eye, I should get constriction in my left eye as well. It's called consensual constriction. Okay, because there's communication between the two eyes. So, these dark eyes. So when I do that, I'm looking how quickly her pupils respond. Do they shrink to about the same size with the light swing test? And then I'm looking, and it's hard with these lights on to see, but if the other pupil is moving also. So that's ipsilateral constriction with light exposure and consensual constriction on the opposite eye. Okay? So now I've tested eye movements, oculomotor eye, I've tested optic nerve 2, and I've tested pupil reactivity. And then again, you're looking at posture, symmetry in her eye, and for ptosis. What's ptosis? Okay, and what muscle is responsible?
The levator,
palpebral, something like that. And the reason why I'm telling you is because we did see a person in Connie's clinic that had that very same problem. Very interesting. Okay. Now, cranial nerve 4. What muscle? Lateral rectus. Okay? No, superior oblique. Superior oblique. You got me doing it now. So superior oblique, lateral rectus is 6. So for 6, for motor, I'm basically looking to see if she can move her eyes laterally. So if I bring the stick to the left, and her left eye goes laterally, but her right eye is still looking straight ahead, it's her right eye that has the problem. Does everybody understand how I just said that? If I am asking her to look to the left, and her left eye looks to the left, but her right eye looks straight ahead, the problem is in her right eye. Okay? The one that's not moving. That can't go in the proper direction. Good? So that's 6, and then of course, we said for 4, we were going to go with the convention that we're testing it down and out. So, down and out, on the right. Down and out on the left. Okay? Everybody good? So that's 4. We just did 6, and 3 was before that. So when I do 3, 4, and 6, I do all the same movements, but I'm actually looking for different muscles when I do them. Because it's quicker that way. Otherwise, I'll be like, okay, this is 3, then I go back and do it again. That's 4. So you should be like, I'm doing the same thing. You get it. Okay? But that's just for your differentiation. When you do it with an actual patient, you do all of them together. Everybody understand? Okay. Okay, 5 is sensory to the face. So we can look at opening and closing the jaw for the motor component. So have her open and close and open against resistance and hold. So you could do a manual muscle test. Okay. And then sensory to the face. That's when you do your sharp dull. And again, exactly the same way. Okay. Find an area that you know is intact. So I'm going to touch you with this. I'm going to call this light touch. Can you feel me touching you? Okay. So I'm going to do the same thing in your face. I'm going to have you close your eyes, and I want you to tell me when you're feeling it, and just tell me where you're feeling it.
Light touch on my mandible.
Which side?
Left. Light touch on my right side. Light touch on my left.
So I would continue to do the 3 areas. Mandible, ophthalmic, and maxillary, ophthalmic. Okay, and how many trials do I do?
5.
5, and how do I document it?
How many right out of
3 out of 5.
Right. And if it's, let's say it's 3 out of 5, questionable 3 out of 5, how do I?
Right.
What is it?
6 trial.
Well, you could do an extra trial if you're not sure. But what do I write? It is intact.
Which one?
It's impaired. It's impaired. Okay, so it's not intact, it's impaired. It's not absent, so it's somewhere in the middle, right? It's impaired. Okay? And then sharp dull, same thing. I find an area that I think is intact. I'm going to call that sharp. Okay? When I touch your face, I want you to tell me if it's sharp or dull and where I'm touching.
Dull on my Dull. Left. Sorry. Sharp left. Sharp right.
So, and again, you do multiple trials. Okay. It's okay.
Oh, they're all trying.
It's okay. You don't have to pick up points with your chin, so it's
Yeah.
all right. So that's sensation to the face, and then the mandible. Now, this is the jaw jerk too, isn't it? I wish I had that big reflex hammer that we had in that video.
On the baby.
Yeah, they use it on the baby.
I do.
Okay, so you just relax your mouth. It's hard to tell.
Yeah.
It's hard to tell. I can't even tell.
Yeah, it's hard to tell. I mean, it did look like there was a little something there, but I don't know if that's just her reacting to me hitting her face or. But it's a very small movement, and if you don't see it, it's not something I get particularly hung up on.
They can't relax. I feel like that won't happen either.
It's hard.
Hard to relax her.
Okay. All right. So that is 2, 3, 4, and 5. If you want to practice those before, 2, 3, 4, and 5, and 6. If you want to practice those before we move on?
No, also 7. Or no, 6
Five?
7 is spatial.
Yes. I haven't gotten to 7. That's the expression.
Oh, you did facial sensory.
Yeah.
Uh-huh.
Don't confuse me.
I'm
It
confused.
doesn't take much. Okay. You want to practice? Say yes. Practice.
Yes.
Yes.